So in 2026, we're seeing that there's not as much intense volume for breast implants. Are you seeing that too?
Very much so. So the trend in 2026 is towards smaller implants, and that's for better proportion, comfort, and movement. So the days of double D, triple D augmentations are completely over. The modern era is preserving the patient's tissue, placing smaller implants, and letting them get back to their healthy, active lifestyles quicker.
And what do you see driving that change?
I think it's that patients have very active lifestyles and they want something that works with their body. So they're looking at more things that give them longevity as well as comfort, better appearing in clothing, but also that work with them when they're exercising or going to the gym.
So on the flip side of that, are you seeing an increase in reductions coming in?
Our reduction population is always fairly steady, so women with large breasts often suffer from multiple other symptoms, which really brings them in the door trying to address those.
And how do you guide patients through that sizing discussion?
We like to focus on anatomy, tissue quality, and patient-centered outcomes. So using multiple different systems such as a sizing kit or a virtual simulator, as well as taking measurements, we determine what the proper size implants are to achieve the patient's goals, but also give them the most longevity and the most comfort.
And what else do you think that patients should know if they're considering a breast surgery?
Well, there's a lot to know about breast surgery, and I think there's a lot of confusion. Patients aren't sure if they need an augmentation, a reduction, or a lift, or how those procedures all work together. There's also a lot of questions that patients have specifically about implants or fat grafting to the breast in order to achieve volume. So I think really a candid one-on-one talk, a consultation with a board-certified plastic surgeon is the way to go to get more information.
And how can they make a consultation with you at the Facial Surgery Center?
Just by calling 843-571-4742 and I'll be right here. No.